Hello, I'm Samuel Pihan, an attorney for CCK Law. I'm joined by Emma Peterson, a partner at the firm. Today, we're going to be talking about the most common mental health claims that we expect to see in 2025. So, Emma, why might 2025 be an interesting year for mental health claims?
Well, VA might finally launch the mental health rating changes it's been working on for years. We have other videos coming soon on the new criteria, but in short, these changes are based more on functional impairment rather than social or occupational impairment. These seem like they could be more favorable to veterans. For example, new criteria does not require the veterans be unable to work. So it's possible a veteran rated at 70% could now get a higher rating. The changes could lead to new mental health claims and ratings this year due to some veterans filing before the changes in order to use the current criteria, and other veterans filing increased ratings after the changes to take advantage of the new criteria.
So, with that in mind, we thought we'd take a look at what the most common claims are likely to be. If you suffer from one of these mental health disorders as a result of your service, you are not alone. We encourage you to file a claim and get the support you deserve, like those before you. All right, so what is the most common mental health VA claim that we expect in 2025 and why?
So, post traumatic stress disorder, PTSD, is one of the most prevalent mental health conditions among veterans. More recently, it's been the fourth most common VA disability claim overall.
So, for anyone wondering how broad the term is, what are the type of situations that might lead to PTSD claims?
Sure. So PTSD can result from many types of stressors during service. It can be combat related. There's non combat related stressors like military sexual trauma, MST. And there's other stressors such as witnessing accidents or injuries to fellow service members.
So, how does VA rate PTSD?
PTSD is rated under diagnostic code 9411. Right now, the ratings range from 0% to 100% based on the level of occupational and social impairment. After VA's ratings change, the ratings for all mental health conditions will still range from 10% to 100% and be based more on functional impact, like the ability to navigate or take care of oneself.
So, what is the next most common mental health claim we expect to see, and how common is it?
Sure, so major depressive disorder or clinical depression is the 14th most claimed VA disability. It involves persistent feelings of sadness and loss of interest that can significantly impact daily functioning.
And how does VA rate depression?
So, VA rates depression under diagnostic codes 9434 and 9435. And like PTSD, it's the same underlying criteria for all mental health conditions. So, right now it ranges from 0% to 100%, but that will change with the new mental health rating schedule.
Okay, so what are the next most common mental health claims, and how common are they?
Sure, anxiety disorders are currently the 19th most common VA disability claim. These kinds of disorders involve excessive worry, fear, and panic that interfere with daily life.
And how does VA rate anxiety disorders?
Same way as it rates PTSD and depression. It's under diagnostic code 9400, but the underlying criteria are the same.
And what are other common mental health related VA claims?
Sure, we often see veterans with chronic adjustment disorder, somatic symptom disorder, also known as chronic pain syndrome with depression and anxiety. These have both been seen in the top 25 or so claims over the years.
Okay, thank you, Emma. Again, if you suffer from one of these mental health disorders as a result of your service, we encourage you to file a claim. Mental health is a significant issue for veterans, and VA does approve a large number of claims like these each year. If you already have one of these mental health ratings, you might want to research the new rating criteria and see if an increased rating claim seems like a good idea. Like and subscribe to get more updates as the new year progresses. Take care.